locking, what we have established and in the vernacular called closed lock, not open lock. Open lock is you're wide open, you can't close all the way. And I've treated many of those in my career as a maxillofacial surgeon. But the one we're talking about is closed lock. You can only open so far, and usually about halfway when it's its worst. Of course, I've seen people can only open 10 millimeters or temporary, but those are the symptoms. That is the definition. There are a lot of other definitions out there, and we're going to cover some of those eventually that don't make sense, and we'll cover why they don't make sense. So let's next go right to the meat, the heart of what I've established here as a practitioner over the past 10 years. I guess it's a little time to tell you a little bit about my background so it makes a little sense. So I went to college like everybody else did in Cleveland, Ohio, dental school at Indiana. By the time I finished dental school, I also had a master's degree. After the fourth year, I fit in a master's degree in anatomy, cell biology, and then ended up at Vanderbilt and did my surgical training, internship residency, and did my medical degree and worked an MD, PhD, and also had an independent fellowship with the NIH for 2 years. Had my own independent project, which may have time to talk about way later and how all that came to be, but it had nothing to do with, well, it did have something to do with TMJ for sure.